How to increase dopamine ADHD. What is ADHD in children? ADHD is an abbreviation for the diagnosis Attention Deficit Hyperactivity Disorder, that is, disturbances of attention, activity, and impulsivity. Children with Attention Deficit Hyperactivity Disorder were first described more than 100 years ago. How does the disease progress? About half of the children diagnosed with ADHD will still have difficulties as adults. In puberty and adulthood, they have an increased risk of emotional problems, anxiety, depression, involvement in traffic accidents, and the development of substance abuse. In addition, there is an increased tendency for them not to get a proper education, have difficulties adapting to the labor market, and end up in crime. Also read ADHD in adults. Who gets the disease? Surveys show that 2 to 5% of all children have ADHD. Boys are affected approximate 4 times more often than girls. What causes ADHD in children? ADHD occurs as a result of a faulty development or an immaturity in the brain. There are several causes of ADHD. Heredity, effects on the nervous system during pregnancy. Premature birth or low birth weight, brain damage occurring in the early years of life, as well as social and environmental influences in early childhood. It has not yet been mapped what happens in the brain of children with ADHD, but there are disturbances in the function in 2 areas of the brain in particular. An area central to the base of the brain called the nucleus caudatus. Here, among other things, the brain's alertness and focus of the senses are controlled with the help of the signaling substances dopamine and noradrenaline. The nucleus caudatus area is smaller in children with ADHD, and there is less activity there in patients with ADHD compared to healthy individuals. The frontal lobes, which control the brain, regulate impulses, and are responsible for planning and overview. Here, reduced blood flow has been established. Reduced activity in the frontal lobes leads to a reduced ability to inhibit impulses and to create an overview. A general delayed maturation of the cerebral cortex is seen in the form of a 2 to 3 year delayed isolation of the nerve fibers, widespread throughout the brain. Symptoms. The symptoms fall into 3 areas: inattention, overactivity, and impulsivity. The problems must be present before the age of 7 and have lasted for at least 6 months for one to speak of ADHD. The difficulties must also be observed in several situations, e.g., at school, at home, and in leisure activities. It is often accompanied by other problems, such as motor coordination difficulties, behavior disorder, sleep disorder, and learning difficulties. How to increase dopamine ADHD. Dietary dopamine supplementation. Consume meals high in tyrosine. Tyrosine, an amino acid, is required by your body to produce dopamine. The amino acid enters your body and goes to your brain. Once there, the neurons responsible for dopamine release use additional enzymes to convert it to dopamine. Cheese, fish, meat, nuts, grains, dairy, beans, and soy are high in tyrosine. As long as you eat enough protein, you should be able to acquire adequate tyrosine. To calculate how much protein you require, multiply your body weight in pounds by 0.36 grams for example. If you weigh 150 pounds, you will require 54 grams of protein. For example, 0.5 cup cottage cheese has 14 grams of protein, but a portion of chicken the size of your hand contains around 19 grams of protein. To acquire your daily dosage of phenylalanine, eat protein-rich meals. Tyrosine may be synthesized in part from phenylalanine, therefore consuming foods high in this amino acid can help you receive enough of it. As a result, dopamine levels may rise. This diet is abundant in meats, cheeses, and wheat germ. This amino acid is also found in artificial sweeteners. You should have at least 5 grams of phenylalanine each day, but you can get up to 8 grams. Many cheeses, for example, contain roughly 1 gram of phenylalanine per 3 ounces. Get your daily caffeine fix. Caffeine is one of the most common ways to boost the body's utilization of dopamine.